When it comes to varicose veins, it's better to get treatment sooner when symptoms first appear rather than later when the veins have gotten worse. Here to explain is vascular surgeon Dr. William H. Edwards from the Vein Center, along with his patient, Lauren Wilson. Welcome to the show.
Thanks, Casey.
Dr. Edwards, we've had you on before talking about how it's so important to get treatment earlier rather than later, like we just said. And your patient, Lauren, is a prime example of why you shouldn't wait.
Exactly. Lauren began to have problems during her second pregnancy, and she developed varicose veins then. She had delivered the baby, and her varicose veins kind of went away. She had a little bit of problem, but not much. And in her third pregnancy, they got really bad, to the point of having to get some bed rest and even having her baby early because of it. Wow.
So let's talk more about your situation. It was really bad, wasn't it?
It was very bad. Like Dr. Edwards said, my second pregnancy, right at the end, they started to come out, but they went away after delivery and kind of only came out when I would work out or run. And with number 3, they came out before I even knew I was pregnant. That's how I kind of figured out that I was pregnant, was that the veins showed up and just progressively got worse and worse daily, to the point where it was just excruciating pain, the worst pain I've ever felt due to these veins. And then with the weight of the baby, the pressure that the baby puts on your veins, as well as how bad the veins were, was just not a good combination.
Yeah,
and the discoloration, right, on her pictures you could see on the one of her ankle, that bluish discoloration went away after the treatment of her veins, and that was the area that was the most painful, down around the ankle, where she was having so much discomfort.
There's the ankle there.
Right.
Can you even believe that's your leg?
No, I cannot. I cannot believe it. It was very, very painful, and to the point at the end where, like Dr. Edwards said, they did take the baby early because I was probably going to ulcerate. When I would put my foot in water, it would sting, like the skin was breaking down, deteriorating. So to safely have the baby and to safely have mommy, you know, we took the baby early as a decision. So
a dramatic difference, and it's hard to believe it wasn't that long ago.
No, it was not. It was, well, I had the baby in March, and we just had the surgery in September, so not too long ago. And I think the hardest part was throughout the pregnancy not being able to be active, because I usually am a very active person, so not being able to run or walk also added to the pain of the veins, just not being able to stay up with my physical activity.
Absolutely. So you were obviously in a lot of pain. Were you apprehensive about the treatment? Can you describe the process of that?
The process was actually very easy. I was super excited about the process, just to know that maybe there was a light at the end of the tunnel, that maybe my legs would go back to normal and I could possibly wear shorts again. But you know, the process itself was very easy, and
you got immediate relief too.
Oh, immediate, virtually painless. And all my family members that had seen the veins during pregnancy were just amazed at the visual difference, and I of course was amazed at the physical feeling different. The pressure was gone, the pain was gone, and you know, so it was great.
Now, did you realize at the time that how delaying the treatment, how that would affect you? Did you realize that if you had gone to help earlier, it would have made a big difference?
I did not realize that. You know, like we said, they kind of went away, so it was kind of not in the forefront of my thinking and my brain. So I had no idea that they would come back this bad. So I would have obviously fixed them if.
And each pregnancy can make them worse.
Yeah, you were saying that it is very typical to have it come out during pregnancy.
Right, yeah, there's physiologic changes in the body of the women who are pregnant that make it more common to have varicose veins during pregnancy, and typically they go away when those physiologic changes go away with the delivery of the baby, but another pregnancy is going to cause them to come back, and what will happen as you get older, longer exposure to gravity, it's going to make them come out too.
Right. Well, from the pictures we saw, obviously a huge difference in how your legs look, but how do you feel? Has it made a big difference?
Oh, it's been a huge difference. I feel so much better. I'm able to play with my kids, you know, normally now, and I'm starting to run again and do my yoga and be able to work out and feel better about myself and the baby weight.
A brand new woman.
And you might wear shorts again, right?
Exactly, I will wear shorts next summer.
Right, something to look forward to.
Exactly.
Well, thank you so much. I'm so glad you're feeling better and looking better, and they just really helped her out. Thank you so much. And we have a special offer for folks today too. This is for the first 10 callers to 615-269-9007. They'll receive a complimentary consultation or a second opinion. Again, the number is 615-269-9007. And the Vein Center has 2 locations, one in Belle Meade at 615-269-9007 and another in Cool Springs at 615-503-9895. You can also find more information on their website. There's a link on the More at Midday section of WSMV.com.